Let me ask you something. Have you ever been told your blood tests are normal, but you still feel tired, weak, unmotivated, or not quite yourself? Because here's something most people don't realize. Vitamin D deficiency is one of the most common nutrient deficiencies in the world, and most people who have it don't know it. Not because they're careless, but because the symptoms are subtle, slow, and often blamed on stress, age, or lifestyle. In this video, you're going to learn 10 symptoms of vitamin D deficiency that are commonly overlooked, even by people who eat well and try to take care of their health. And later, I'll explain why so many people take vitamin D and still remain deficient, and what actually needs to change for it to work. Because once you understand how vitamin D works in the body, many confusing symptoms suddenly start to make sense. Let's start with something important. Vitamin D is not just a vitamin, it acts more like a hormone. It affects over 1,000 genes and plays a role in immune function, muscle strength, mood regulation, bone metabolism, inflammation, and insulin sensitivity. And yet, deficiency is extremely common, even in sunny countries. Why? Because vitamin D production depends on many factors: sun exposure, skin type, latitude, age, body fat, and liver and kidney function. You can spend time outdoors and still be deficient. Now let's look at the symptoms. One of the most common signs of vitamin D deficiency is persistent fatigue. Not the kind that comes after a bad night of sleep, but the kind that stays even when you rest. Vitamin D plays a role in mitochondrial function, which is how your cells produce energy. When levels are low, energy production becomes less efficient. This often feels like constant tiredness, low motivation, or feeling drained without a clear reason. Many people assume this is stress or aging. In reality, vitamin D deficiency is often involved. Vitamin D is critical for immune regulation. It helps activate immune cells and modulates inflammation. When levels are low, the immune response becomes weaker and less balanced. This often shows up as frequent colds, slow recovery from infections, or feeling like your immune system isn't as strong as it used to be. People with low vitamin D tend to catch respiratory infections more easily and take longer to recover. Vitamin D receptors are present in areas of the brain involved in mood regulation. Low levels are associated with low mood, lack of motivation, emotional flatness, and increased risk of depressive symptoms. This doesn't mean vitamin D is a cure for depression, but deficiency can clearly worsen mood and emotional resilience. This is especially noticeable during winter months or periods of low sun exposure. Vitamin D is essential for muscle function. Low levels impair muscle contraction and recovery. Over time, this leads to weakness, not necessarily muscle loss, but reduced functional strength. This often feels like legs feeling heavy, difficulty climbing stairs, or reduced exercise performance. In older adults, low vitamin D significantly increases the risk of falls due to muscle weakness. Vitamin D is required for calcium absorption. When vitamin D is low, calcium absorption drops, even if calcium intake is adequate. This leads to changes in bone metabolism. This often presents as deep bone aches, lower back pain, hip discomfort, or persistent soreness that doesn't feel muscular. Many people assume this is joint wear or aging, but vitamin D deficiency is frequently involved. Now notice something important. None of these symptoms are dramatic. They don't appear overnight. They slowly become part of normal life. And that's exactly why vitamin D deficiency is so often missed. Vitamin D plays a role in the hair growth cycle. Hair follicles contain vitamin D receptors, and when levels are low, the growth phase of the hair can shorten. This doesn't always cause sudden hair loss, but it can lead to increased shedding over time, slower regrowth, and thinner hair. Many people attribute this to stress, hormones, or age. And while those factors matter, vitamin D deficiency is often part of the picture, especially when hair thinning appears alongside fatigue or low mood. Symptom 7. Joint pain or stiffness without clear injury. While vitamin D is usually associated with bones, it also affects joint health and inflammation. Low vitamin D levels are linked to increased inflammatory signaling, which can show up as joint stiffness, achy joints, or discomfort that feels worse in the morning or after inactivity. This kind of pain is often mistaken for normal aging, when in reality, vitamin D deficiency may be contributing to chronic low-grade inflammation. Symptom 8. Slow wound healing. Vitamin D is involved in cell growth, immune response, and tissue repair. When levels are low, the body becomes less efficient at repairing damage. Cuts, bruises, or minor injuries may take longer to heal. This symptom is subtle, but it's a sign that the body's repair systems are not functioning optimally. Symptom 9. Poor sleep quality. Vitamin D influences sleep regulation, including the production of melatonin. Low levels are associated with difficulty falling asleep, lighter sleep, and waking up feeling unrefreshed. Many people focus only on magnesium or sleep hygiene, but vitamin D deficiency can quietly undermine sleep quality, especially when combined with fatigue and low mood. Symptom 10. Increased fat gain or difficulty losing weight. Vitamin D plays a role in insulin sensitivity and fat metabolism. Low levels are associated with higher insulin resistance, increased fat storage, and difficulty losing weight, especially around the abdomen. Vitamin D deficiency doesn't cause weight gain by itself, but it can make fat loss harder by disrupting metabolic signaling. Now, take a step back. If several of these symptoms sound familiar, that's not a coincidence. Vitamin D deficiency doesn't usually show up as one dramatic symptom. It shows up as many small signals that slowly affect quality of life. Now, here's the most important question. If vitamin D deficiency is so common, why do so many people take vitamin D and still remain deficient? This is where most people go wrong. Why vitamin D often doesn't work. The most common mistake is dose without context. Vitamin D is fat-soluble. It needs fat to be absorbed properly. Taking it on an empty stomach or with very low-fat meals reduces absorption significantly. Another mistake is inconsistent intake. Vitamin D levels don't improve overnight. Sporadic supplementation leads to minimal changes. But there's a bigger issue. Vitamin D activation depends on the liver and kidneys. If liver function, magnesium status, or overall metabolic health is compromised, vitamin D may not be efficiently converted into its active form, even if intake looks adequate. This is why people can take vitamin D for months and still see low levels on blood tests. Now let's talk about the solution, a clear and practical solution. The goal is not just to take vitamin D, the goal is to restore functional vitamin D status. Here's what that looks like in practice. First, get consistent sun exposure when possible. Short, regular sun exposure, without burning, helps support natural vitamin D production. This doesn't mean hours in the sun, and it doesn't replace supplementation for many people, but it helps. Second, take vitamin D with a meal that contains fat. This single change can significantly improve absorption. Vitamin D works best when taken with the largest meal of the day that includes healthy fats. Third, ensure adequate magnesium intake. Magnesium is required to activate vitamin D. Without enough magnesium, vitamin D remains less effective. This is one of the most overlooked reasons supplementation fails. Fourth, be patient and consistent. Vitamin D levels rise slowly. Improvements often take weeks or months, not days. Consistency matters more than high doses taken occasionally. Fifth, consider testing when appropriate. Blood testing provides clarity. It helps guide dosing and avoids guessing. Optimal levels are individual, not one size fits all. And finally, address the broader context. Sleep, stress, digestion, body fat levels, and overall metabolic health all influence how vitamin D functions in the body. Vitamin D is not a magic fix. It's a foundational signal. When that signal is restored, many systems function more smoothly. Energy improves, immunity stabilizes, muscles feel stronger, mood becomes more resilient, and recovery improves. And this brings us to the key takeaway. If you've been told everything looks normal but you don't feel normal, vitamin D deficiency may be part of the missing piece. Not because vitamin D fixes everything, but because without it, many things don't work as they should. Understanding this changes how you approach your health.